Assalamualaikum doctor. In this video I am discussing how can we management of myocarditis history. So first of all, I have already taken the history. I will examine the child and also give some investigations. So what are the examination? First of all, ABC must, ABC vitals, child pulse rate, child is in shock or not. These are we'll do. Cardiology examination we can do, and then I will admit the child in ICU unit. So we run some tests: full blood count, peripheral blood film, blood culture, inflammatory marker ESR, CRP, and ferritin, cardiac enzyme, myoglobin, troponin, TNI, CKMB, NPN, LDH, D-dimer, urea and electrolyte, creatinine, liver enzymes, viral PCR and viral antibodies. ECG we do. We can expect there is sinus tachycardia, that is ST segment elevations, then ST segment inversion, QRS and QT prolongations, low voltage equals severe disease and arrhythmia, V tachycardia, that is ventricular tachycardia, imaging chest X-ray, cardiomegaly and echo, low ejection fractions. Management plan is that airway, breathing and circulation, AVC, admit to the ICU unit. If the child is in pain, I will give analgesic. If shock, give shock therapy on 10 ml per kg for fear of volume overload. Repeat if needed. Discuss with the consultant for inotropic support, dopamine and dobutamine for hypotension and low ejection fraction. Inotropic support, dopamine and dopamine. Antibiotic empirical according to blood culture. Steroid for inflammation, IV immunoglobulin. Diuretic if volume overload. Antiarrhythmic if arrhythmic. Mechanical ventilation. Then prognosis is most will recover, but some of them will have permanent cardiac problem. Treatment is mainly supportive to maintain the cardiac function until the inflammation subsides. Complication is dilated cardiomyopathy, heart failure and arrhythmia. So the management of acute myocarditis I am telling after taking the history. I revise my note. I will child airway, breathing, circulations I will check, and pulse rate, child is in shock or not. I will see this, admit to the ICU, involve my senior. I will run some tests like full blood count, ESR, CRP, inflammatory markers, and the ECG, echo, chest X-ray, ECG, echo, chest X-ray. In ECG, we can find sinus tachycardia, that is ST elevation following by ST inversion, prolonged QRS complex, then echo, that is low ejection fractions, and cardiomegaly in the chest X-ray. We can do the troponin TNI, troponin T and I, then D-dimer, cardiac enzyme, these are myoglobin, troponin T and I, CKMB, BNP, LDH, D-dimer, urea electrolyte, and the viral PCR antibodies. Treatment is that first ABC, then I will admit the child on an ICU, then I'll check the child is shock or not. If shock, we will give 10 ml per kg because of fluid overload. Then inotropic agent with my consultant, dopamine or dobutamine I will give. Then empirical antibiotic we start according to culture sensitivity. Diuretic if volume overload, if arrhythmic, antiarrhythmic if arrhythmic, IV immunoglobulin we give. Steroid for inflammations, mechanical ventilations. So what are the treatment? AVC we are doing, shock therapy 10 ml per kg we are giving, inotropic agent dopamine, dobutamine we are giving, steroid for inflammation, IV immunoglobulin, antiarrhythmic, diuretic, mechanical ventilation. Complication maximum improve as some have problem occur. Complications are it can be dilated cardiomyopathy, heart failure and arrhythmia. Dilated cardiomyopathy, heart failure and arrhythmia. So this is all about myocarditis management. Thank you.